This stage of South Africa's mass vaccination program comes at a time when the country braces itself for a possible nationwide third wave. At the moment, Gauteng is the only province that has confirmed that the third wave has hit the province. On the eve of the second phase of the massive rollout vaccine against the coronavirus, we talked to two frontline healthcare workers who've recently took the jab. We're joined via Zoom by Michelle Mulder, a practice manager for different medical doctors, and Sunita Pillay, who is an admin clerk at a hospital. A very warm welcome to both of you, ladies. Michelle, let's start with you. Why did you decide to take the vaccine?
Good day, I'm Michelle. Lovely to meet all of you. So first of all, I had COVID-19 early December last year. And my main reason for taking the vaccine is, first of all, I would never ever want to experience being so ill again in my life. I was in hospital for 10 days on oxygen. And then, as most of you guys know, COVID is also a very emotional thing. And I've got a 3-year-old daughter, which I wasn't able to see for quite some time. So one of my other main reasons was so that I'm also protecting my child through getting the vaccine and won't ever have to be away from her for that long.
You know, Michelle, we only hear stories about how horrendous the experience is. Just give us a sense of what you go through at that time.
Well, obviously, emotionally, physically, you're just so uncertain. You don't know what's going to happen. I'm only 26 years old, so I'm quite young. I'm healthy. I don't really have any underlying conditions. So when I was diagnosed with COVID, I was quite shocked. I mean, I was by my 3rd day in hospital. I was so ill, I could barely stand up and help myself to the toilet. So I was so shocked that I was so ill in the first place. And then second of all, like I say, all the uncertainty that goes with it. You are a mom. You think to yourself, am I going to be able to walk out of here and ever see my child again? So yeah, I honestly do not think that this virus is a bunch of nonsense. It made me very ill and it gave me a big fright. And up until today, I'm still scared of it because anything can happen. So yeah, I'm very privileged and happy that I got the opportunity to take the vaccine.
Sunita, what were your reasons for taking the vaccine?
So I would like to say good afternoon to each and every one, the listeners as well. The reason for me taking the vaccine, I have decided to get vaccinated to prevent myself from contracting the deadly virus. As a country, we are now entering the third wave, which is very scary. The second wave that hit South Africa late last year was very deadly. So getting the vaccine will definitely protect us against the virus.
Yeah. Let's just talk to both of you about the process because, for instance, about 2 days ago, we had a story here in Gauteng about healthcare practitioners who are still out of the loop and have not been vaccinated for various reasons. Others for initially being hesitant to go through and vaccinate. Michelle, take us through the process for you. What was it like? Was it easy? Was it smooth? What happened?
You meaning about the process when I went to the hospital for the vaccine?
From registering until the vaccination, until you were actually vaccinated?
Yes, it was very quick and sufficient. So Sonki really did a good job with that. After getting my voucher number and applying all the questions on the online link, it was within a few hours. And then I got my date and my time. So I went for the vaccine on Friday at Mill Park Hospital in Johannesburg. It was a very busy day. It was a long day, but absolutely worth it. They even made it convenient for the people there as far as they could. I mean, there were loads of people. And as I said, it was a long day, but at the end of the day, it was worth it. When you get into the side where you're actually going to get the vaccine, the sisters are so friendly, the staff are so helpful. So it was a very efficient process.
You were part of that Mill Park group that we were reporting on. Was it frustrating for you that at this stage of the vaccination, there were still so many healthcare practitioners left to still be vaccinated?
Yes, it was. It was scary to see how many people are still standing there from various kinds of hospitals, from Life, Netcare, the Mediclinics, to think that there's so many health workers that's still standing in the line. Obviously, it did cross my mind to think, how did it come to this point? But like I said, at the end of the day, everybody that was there was assisted, and we all got what we needed.
Sunita, where did you vaccinate and how was the process for you?
I vaccinated at Mold Park Hospital in Johannesburg. I've been there since 8:30 in the morning, which was a long process, but we finally got to the stage or to the scene where the nurses had to vaccinate me at around 2:30 the very same day on Friday. I was with Michelle. The queue was very long. There was a point at around 9:30, I must mention, there was only 3,400 vaccines left, which they started counting. And there were so many people. It is a long wait to get to the screening center where they're going to now take in your details. But the process is very fast once you get there, once you reach to that point. I must say the nurses were very sweet, very helpful. Even after you get in the vaccine, they were more careful around you and making sure that you were stable to then leave the building.
Are you experiencing any post-vaccination symptoms, Michelle?
Today, I'm feeling 100% fine. Yesterday wasn't the best day. I had quite a bit of high fever and body aches, but that only lasted for a few hours. And what I did was I just drank paracetamol every 4 hours. And then this morning I woke up and I'm perfectly fine.
And for you, Sunita?
Yesterday was not my very good day as well. I had all the side effects, cold shivers, as well as a high fever, body ache, headache. So your body then goes into a cold shiver, which lasts for a day or two. But today I'm feeling much more better. I only have a backache.
Yeah. Let me ask both of you ladies, now that you have vaccinated, you know, right from the beginning of the outbreak, we kept being told that protecting yourself is not just about you, it's about protecting other people as well. Now that you have vaccinated, do you feel like you have performed some sort of national duty? Michelle?
Yes, I definitely do feel so. I was a bit scared of the vaccination, but like I said, I did it especially to protect my daughter and the loved ones around me. So I feel a lot of relief now that I took it, and I'm very, very happy about that.
Yeah. Cynthia?
I feel much more safer that I took the vaccine and got it over and done with. And I feel that now I'm so safe and around my family, my loved ones as well. And it doesn't mean that I got the vaccine that I should not follow the steps, as in wearing my mask, sanitize, and social distancing. That should still carry on. But with that being said, I feel so much safer.
I'm glad you responded to the question, well, I hadn't asked it yet, but about continuing to keep the protocols. Michelle, just give us a sense of what you're told after you've been vaccinated, the things you can and cannot do just because you're now vaccinated. Are you told you're now protected, you can do what you want?
No, so after you get your jab at whichever hospital, you have to sit down for 15 minutes. So the nurses look after you and they just make sure that you're okay and don't have any allergic reactions. So in that 15 minutes where they take care of you, they also explain to you that you cannot run out of the building and do whatever you'd like. You must be just as careful. You must still sanitize, wear your mask, follow the protocols. You are just protected in the sense of hopefully not being exposed so much, but it doesn't mean that you are completely now can just go run out there and do what you like. So yes, and I will definitely make sure, like I say, I've had it before, and even though I am vaccinated, I will make 110% sure that I will still follow all the protocols as needed. And by me doing that, you also set an example for the ones around you.
Sunita, would you suggest vaccination to other South Africans? If other people asked you, should we go for it? What would your response be?
Yes, I do. I'll let everyone else get vaccinated. My only concerns around it is the elderly people who are 65 years and above with regards to the side effects, will their body handle it. But I still state that everyone should still get the vaccine.
And Michelle, would you recommend it to other people?
Yes, I would. So there's obviously a lot of conspiracies going around, and also what works for my body might not work for the second person. At the end of the day, we're all just human and not everything works for everybody. But if you were in my situation where you were very ill and you need to protect people around you, I would rather say take it and take the chance of taking the vaccine instead of getting the deadly virus, and will never be able to see your loved ones again.
Ladies, you're among the lucky ones. Research says 71% of South Africans would like to get vaccinated, and numbers say only 1%. And I imagine you're in that number. I suppose you are in that number since you have been vaccinated, that 1% who have already been vaccinated. Just to move away from the conversation, and really congratulations to you, but just give us a sense as South Africans, as people who are in the front line, in the healthcare practice, your experiences in the past year. How has it been like for you, Michelle?
It has been very emotional. There's so many things that goes around it. The main thing is, as much as this virus is deadly to your physical body, it is very emotional draining. I mean, especially for the doctors, they face death every single day, and the nurses and the staff, and even the normal PAs in the hospital. You walk around there and you need to see families that just had to say goodbye to their mom or dad or anything like that. So it has been a massive, massive emotional journey. If I have to take it for in the last 12 months, it has been emotional draining. But I honestly hope and pray that everything will just go smoothly from here on, and that the rest of the country will be fortunate enough to get a vaccine as well.
Sunita, you're an admin clerk at a hospital. All right, I think we seem to have lost Sunita there for a second. I don't know if she will come back, because it was going to be quite an important question that I wanted to ask you. But Michelle, let's continue with the conversation now. And now that you are vaccinated, how are you feeling about prospects for the future?
Sorry, say again, how do I feel about?
Prospects for the future, because there was such a lot of uncertainty and anxiety about the possibility of contracting COVID-19, but also on a daily basis, we're talking about escalating deaths. I mean, we're talking about a third wave now. Are you feeling more certainty?
Yes, I honestly feel more calm now, and I think that hopefully I won't be one of those that the third wave hits. So yes, I do feel, like I say, we still need to continue with protocols and still look after ourselves and still take vitamins and all of those things. But yes, I do feel a bit safer.
Yeah, and also, do you feel a certain level of ease having to deal with other people now?
Yes, I do. I honestly do, because I think with me getting it, I'll protect the ones around me. Maybe I would have not had it again, but maybe I would have been a carrier. So for me getting it, I would hopefully protect the ones around me as well.
Yeah. Sunita, when we lost you, I was still asking the question about your experiences in the previous year. You work as an admin clerk in a hospital. In the previous year, hospitals were seen as, you know, places where people go and die. What was the experience like for you working in a hospital? And as an admin clerk, you're almost like the first port of contact when people come into a hospital. Just take us through what that was like for you. Sunita, are you still with us? All right, we seem to have lost Sunita there, but ladies, all the best for your future. As I said, you're part of the 1% that has already been vaccinated, and 71% of South Africans hoping to, well, having indicated that they would like to get vaccinated. Thank you so much for your time today.
Thank you.
Michelle Mulder, a practice manager for different medical doctors, and Sunita Pillay, an admin clerk at a hospital. And we're talking to them about the experience of getting vaccinated. As we know, as South Africans, we're holding our breath and hoping for a successful start to that phase 2 of vaccination in the country tomorrow morning.